Welcome to Between the Lines. What episode are we on, Chandler? 121. We've been at this a while. Now, 121 episodes, and we're going to turn on through this year. We're going to do a nonprofit series for a few weeks because nonprofits, I think, deserve more focus right now for a number of reasons. And being a Republican consultant politically as a second kind of life, it's probably good for me to go through that. Worked in nonprofits a lot of years. So we're going to talk a little bit about health. You know, I like Kennedy. Most health people don't, but I like Kennedy. And I think the more progressive people I talk about think he's great on the nutritional side and problematic on the immunization side. I think that would be a fair statement, right? And so we're going to talk a little bit about the measles. So we're going to focus on what we're doing, not what's causing the problems. What we're going to do, because measles have come up more in the news.
Yes.
They have come up more in the news. And I think it's a challenge. It's always a health challenge. It always is that way. So we're going to talk a little bit about that for half an hour. We want to spin around and talk to Habitat for Humanity for 30 minutes. It's Easter week. You know, tomorrow's Good Friday. It always was a culture shock for me coming back from Pittsburgh because the whole world shuts down in the East and the Midwest during those times. It's just a different world. You know, it's much more of an intense holiday. And that, not Easter. Easter's everywhere, but I mean that kind of thing. So that's all I got. We're going to talk about it. We're going to see it. We're welcoming our friend back from, how long's it been?
2 years? About 2 years, I think.
And you know, Denette, I honestly, I thought it was about a year. It goes so fast. It goes so fast, et cetera, et cetera. So happy Easter to everybody. Let's get that on the table. Tell us a little bit about what your organization is doing. I think we talked last time about nurse and navigators, and you had a grant and you were doing some things, and I know that County Commission just funded free medical clinic with a nurse navigator. Tell us a little bit about what's going on, and it's really your agenda. Talk about what you really want to talk about.
Okay, my name's Denette. I'm here in Anderson County. This is my hometown.
Her mother graduated with me.
That's right.
Was your mother a cheerleader?
Majorette.
That's right. That's right. I remember that because I remember they went to Kentucky. Where did your mother go to school?
She went to Alabama. Don't tell anybody. She went to Alabama.
Well, we just told about 5,000 people, but that's all right. They won't track the name backwards. All right. So both very talented women, both very. I'm glad they're doing so well. Okay. Sorry.
No. So I work for University of Tennessee College of Nursing on a grant-funded project, and it is funded by Tennessee Department of Health, and it is
passed through federal grant.
I believe it is.
Yeah, usually most of them are. Okay, go ahead.
And we are to address fallen routine immunization rates across Tennessee, all the way across. There's 17 of us across Tennessee. So I'm the East Region, one of two, but I take care of Anderson County and the surrounding counties. So
how? Let's get right into this part. How does Bobby Kennedy's attitudes towards vaccination? The family had issues with vaccinations. That's part of where that comes from. His sister, John's and Bobby's sister, his dad. But the Ned came out yesterday with all these related autism to vaccination things and different things. Talked about how California has a higher rate because they have a broader, more restricted vaccination program. So we don't have time to go into all that. But how is that impacting your program? Are there more people not wanting to get vaccinated because of the rhetoric?
You know, I think vaccine confidence here in Anderson County is very high.
Right.
Vaccine confidence in Campbell County is high. Union County, it's pretty low. It's little groups, small groups, and usually they have the same kind of myths going around about immunizations. But overall, we have good vaccine confidence, so it's really targeting those folks who have been misled. Or there was a terrible study that came out in the late 90s, and it was only 12 kids, and it has been, there was money behind it and all this wild stuff, but that was the beginning of the MMR vaccine with autism. That has since been debugged. Over 600,000 kids in study after study after study found no increase in autism for those vaccinated versus those not vaccinated. So the fact that we're even talking about that was late 90s. Now,
the Kennedy study was this last couple of years, whether it's accurate or not. The sample was bigger, and they're concerned about it. But I don't know. I think my opinion is my wife's still sick and she'll swear it's from the COVID vaccine, not from the COVID disease, because she never had it much, but 3 days, 4 days. And I've tried to explain to people that if you were alive, I wasn't, but if you were alive during the polio years and some other things, there's going to be side effects. I mean, there's going to be collateral damage. And I think going in, knowing what I know from their government, they knew when they came out with a vaccine that 3 to 5% were going to have lifelong or dramatic impacts, mainly from underlying conditions that you can't diagnose in advance, but other things that the vaccine. But all in all, the vaccine was effective for 95 to 97% and it accomplished what they wanted to do. I just think the vaccine people need to understand that, explain to people there's going to be some consequences. Untested 18 months. I mean, most vaccines go through 10 years of testing, correct? Long terms of stuff.
They do.
But COVID, you didn't have that time frame.
No, it was a pandemic and trying to get it under control, so that's a whole different stuff.
I'm sorry. I just want to throw that in.
And I understand people's fears. Like, we all want to do what's best for our kids. I just think that some people are lacking the full spectrum of education to make an educated choice. So our whole job has just been like, let me give you the facts, and then you make the best choice so that you're equipped, so you have the tools to make the best choice for you and your family.
Sure. Okay. So what are you doing now? What kind of vaccines? Tell me about measles. Why is measles an issue all of a sudden?
Measles is an issue all of a sudden because it's highly transmissible. If you have 10 unvaccinated people sitting in a room and one person walks in with measles, 9 of them will catch it.
Without contact?
Correct. It can linger in the air for 2 hours after the person has left the room.
So it's airborne?
It is airborne.
That's weird.
Yeah.
I remember having a kid and staying home from school and drinking lollipops. Is it dangerous?
It is dangerous. About 5 kids out of 10 who get measles will end up in the hospital. A lot of people think of like deaths, but we think about injury. When we were kids, we just laughed at it. We went home, stayed home for a week, and then came back to school. Nobody was ever affected. We never talked about that kind of stuff. Huh. Interesting. But I lived in Oak Ridge, and your mama did. Yep.
We had different kinds of. We were science-based. We didn't worry about it too much. But I don't remember anybody having a measles problem that put them in a hospital.
Oh, yeah.
Not then.
Measles,
I don't remember.
3 to 5 kids.
Worse than mumps?
Yes.
Okay.
Because
Worse
it's more
than chickenpox?
transmissible.
No. I'm talking about the actual experience, once you get it.
I had the measles vaccine, so I haven't had it. But yes, I would say because it can wipe out your immune system too. Like measles attacks your immune system, so even after you've recovered from the immune system, your immune system is handicapped in going forward to fight other illnesses.
Forever?
Not forever.
Okay.
There are some people who have lifelong complications with their immune system after that.
Okay.
And
tell me what areas you cover and what you're doing per se.
So I do Anderson, Campbell, Claiborne, Morgan, Granger, Union, Roane, Scott. Okay. I think that might cover it. It's 9. And Knox County, too. Knox County has a lot more resources. So we really focus on our most vulnerable areas.
Dog's going to get
so cute.
Yeah, she is. Okay. So the more rural a community is, the more questions they have about vaccinations. Would you say there's a correlation there? I do it by Union and Scott. I mean, wouldn't you say that people in, well, maybe let's reverse the question. The more highly educated they are, the more likely they're.
I think some people think that they are highly educated, therefore they think that some quick read will give them all the information they need to know. And I think there are people who are highly educated who are misinformed.
Well, people that are religiously or psychologically or personally have come to the belief that they don't want to do vaccinations, I'm okay with them. That's their decision. They've researched it. Whether you agree or don't agree. It's the people that just make a flimsy discussion and say, I'm not going to get one because I don't like it. Mm-hmm. Well, they're not prepared. They're not. They haven't committed one way or the other. How many vaccinated? I know what I got as a child, right? We had the same 3 or 4. Chicken pox. Or if you had it, you know all that kind of stuff. Mm-hmm. That's the one you hear about, that if you had chicken pox as a child, you may not get this, but if you didn't, you may get that. I hear that all the time.
So chickenpox vaccine didn't come out. I didn't get the chickenpox vaccine. I actually had chickenpox, as I'm sure you did too. Yeah. Anybody born before 1980 is assumed to have had chickenpox. So chickenpox, you wanted to get it earlier in life. I don't know if you remember chickenpox parties. So if you hadn't had chickenpox yet, sometimes your parents would send you to the house of somebody who had it.
That's
because
cruel.
It gets more dangerous as you get older. That's the reason.
I had it at 6 or 7 like everybody else did.
Yep.
Yeah.
And so whether you've had chickenpox or you had the vaccine, later in life you can get shingles. There's a vaccine for
That's
that.
it. That's what it is, yeah.
So it doesn't matter if you had chickenpox by getting infected from someone else or you had the chickenpox vaccine. You are at risk for shingles later in life. You're at risk for shingles anytime once you've had chickenpox.
I don't know too many. I know a few people that have had shingles, but it's not widespread in my community. But what would you say, 1 out of 20?
Who get shingles?
Yeah.
It depends on the age. Once you get up to 80, it's like 70% of people 80 and older have had shingles. And it can come, you can have it over and over again because it's in the herpes virus family.
And it's painful.
Yes, correct.
Yeah. And most of the time it's restricted. Sometimes not, but sometimes it's restricted to your back or your arm or something.
It follows, if you, maybe in health science class, you saw all those nerves that wrap around the body that come out of the spine. It follows one of those. So it can come up your spine and go over your face, and then it's affecting your hearing and your vision. Or a lot of times we see it on the trunk. So it'll come around the midsection. It doesn't cross the midline. That's how you can tell shingles.
Are some people more susceptible to shingles?
If you have a lowered immune system, if you're sick, high stress, anything like that. When you think of cold sores, what triggers that? It's in the herpes family.
Yeah.
So it's the same thing. It always lives in your body. Once you're infected with it, it just stays dormant and then flares back up.
Very, very interesting. So what's going on with measles in East Tennessee? Do we have more people getting affected than we did 10 years ago?
Than we did 10 years
Or
ago.
5 years ago? Or, why is it so big on the news right now?
Well, because we have a huge outbreak that's going on
That's
in
right.
like the Southwest. I think as of yesterday or today, we have about 700 infected. We've had 2 children die. They had no previous health issues, and we've had 1 adult die. So measles, like I said before, it's so easily transmitted, and a lot of people who refuse to vaccinate, they congregate in either like parenting groups, homeschooling groups, co-op groups. They tend to be together, so if one case gets in, that whole group will get infected. It is a live immunization.
Where in Texas?
Lubbock is part of it. I know it's branched out to like 5 or 6 different states now.
And the first thing I'm going to hear, illegal immigration causes a lot of this because they're undocumented and we can't track them health-wise a lot of times. So I know you can treat them, but et cetera, but it becomes problematic and things of that nature. So I don't know.
Most of the majority, they have done collected numbers on that. The majority of people who bring immunizations in, they're United States citizens who travel outside.
That
in
makes
particular,
sense. That same thing. Makes sense.
It's a Mennonite community, and they were going into another country between churches, and so that's...
Makes sense.
Yeah.
Makes sense, doesn't it? I just think a lot of illness of what we've been able to track is that if you're scared to go to the doctor and you don't want to be documented, you don't want to get all this stuff, then you tend to spread stuff, whatever it is, more than other people. Well, wherever you're from. Some people want to go to the doctor and in Kansas, it's just all the same. I'd be interested in seeing correlation rates on some of that stuff. It would be interesting. How does the chart look on measles? I mean, do we see more outbreaks today than we did, or how's that look?
We had a large outbreak in 2014. Some people might remember like the Disneyland outbreak, if they remember that. So 2014, then we had a spike in 2019. Last year, we had one person that I remember because they were a student who traveled to Vanderbilt, and so they had to put out a big PSA. If you were in Starbucks between 10 a.m. and 6 p.m. on this date, you need to go to the health department and get checked.
How do you check for measles?
Well, you're going to check first to see if they've had their vaccines. If you have your vaccines, the 2 doses, a lot of younger people have had the 2 doses, so you would be pretty protected. They wouldn't really watch you. If you hadn't had the measles, they would probably watch.
Now, measles to me is
symptoms.
little red bumps.
It starts with like a fever. You're going to see like a red eye, conjunctiva, and then you're going to have like some nasal stuffiness. You're infectious about 3 to 5 days before you get a fever, a really high fever, and then
I do remember that.
Yeah, and then you're going to get those bumps. So they actually, it looks like salt in the mouth. They're little tiny bumps in the
remember on my
mouth.
body, though.
That's where it starts. Normally, it starts head down, so kind of like at the hairline and comes. Sometimes it's on the trunk. It doesn't hit the palms and it doesn't hit the bottom of your feet, but it's the bumps. And so the incubation period is about 21 days. So you can infect people throughout that before you know that you have it. Before the bumps appear, you're definitely infectious. So
yeah, I think
rash.
the outbreak. Yeah, I think that's interesting. So what do people do if they want to be tested? How do they go get tested?
So right now we don't have an outbreak here. If you have,
That's a good point.
Yeah. So we're not going to use a bunch of resources to do. A lot of people have asked, do I need to go get another booster vaccine? If you have had a measles vaccine or your child has had a measles vaccine, hold your horses. But
Are the people like us that are older in their 60s and stuff who had measles as a child, do they less likely to get it?
you have lifelong immunity if you had measles.
So people that get measles are generally not people who've had measles.
Correct.
Okay, I got it. Who can remember whether they had or not? You got to work it, man.
Yeah.
Mumps. What's the mumps?
So mumps is going to cause that swelling where
Yeah.
it looks like they have that giant throat. That restricts your airway. That's what we're worried about with mumps.
Yeah.
And it can also cause some swelling in other body parts as well, especially teenagers.
Okay. Gentlemen, let's take a break. Our one break of the 30-minute segment, and we'll go from there. Let's take a look. Thank you.
From Oak Ridge, Tennessee, ID3 Global Solutions conducts operations around the world to enhance the U.S. national security posture and minimize radiological and nuclear threats. ID3 Global Solutions. Mission first.
Feeling overwhelmed with your business finances? At P&L Business Services, we handle all your bookkeeping, payroll, and tax needs. From federal tax returns to QuickBooks training, we've got you covered. With over 25 years of experience, we provide customized packages to fit your business. Focus on what you love most, building your business. Let us take care of the rest. Call 865-294-4792. P&L Business Services, empowering you to grow your business.
Prescription drug misuse is a prevalent and potentially fatal problem. When people do not properly monitor, store, and dispose their medications, it can create an opportunity for misuse. Count it. Make it a goal to count your pills once every 2 weeks. Like it. Secure your medications at home. Drop it. Drop off unused or expired medications for proper disposal at any police department in Anderson County. For more info, visit asapofanderson.org. Brought to you by ASAP of Anderson. Prevention works.
Over 14,000 neighbors live in fear of becoming sick or injured and having to make a choice between putting food on the table or seeking medical care. The free medical clinic tries to take that fear away.
What do we help them with? We help them with diabetes, hypertension, any kind of medical need that they need that's necessary. And being in a community with the African American community lets them know that we're here.
Fan Gear Barn is Oak Ridge's source for new and vintage sports fan gear from around the world of sports. Find your favorite team gear at Fan Gear Barn, located at 977 Oak Ridge Turnpike, across from the hospital. Open 10 a.m. to 7 p.m., 6 days a week. Closed on Sundays.
Okay, we're talking to Denette, and we're trying to figure out how to get more people educated. So you actually do programs that reach out to young children, school age.
Yeah, I do programs from anywhere for people who are pregnant, just to let them know what's coming
important.
down and why we're doing these vaccines. A lot of people want to know why. For little kids, hand washing. You know, we had rotavirus that closed down schools for a while, so like that basic hand washing is still so important for infection prevention. And then, you know, when we
Most
start
diseases are spread by touch and stuff.
most are respiratory. When we talk about vaccine preventable illnesses like cold, flu, pneumonia, all those kind of things.
Why wash your hands? Why is that so valuable to do that? Why does that help us?
So a lot of our intestinal things, when you talk about little kids and they're constantly vomiting and throwing up, even babies are really susceptible to dehydration.
The mask was a disaster with kids under 6 years old. I used to watch them all the time. Oh, they take them off.
Trying to pull them off, yeah.
They just couldn't handle it. I'm more of a herd guy. I do believe in herd.
You know, our herd is not going to work, though, when we have larger and larger groups or percentages of unvaccinated people. So we don't really have herd unless the herd is vaccinated.
I say get sick, get it through, make your body immune to it, the way that works. That's the herd mentality. But I've always been, I'll go back to it, I'm always a conformist. Get my shot, let me go back to work. I'm not. I think you're right, though. They did correlations in a California study I read about where they looked at the COVID virus in California. They looked at they couldn't find any correlation to that. The only thing that worked about people who did not get the disease are people who had very high levels of vitamin D. They were stronger. Their immune system handled it better. Obviously vitamin D is used. So it's pretty interesting. So I think people that take care of themselves and don't have underlying issues, I think they can deal with those things with the vaccination or without. I'm not saying don't get vaccinated. I'm saying make a good choice. I'm okay with it.
Plenty of kids died from measles and from polio who were absolutely healthy. I mean, these things.
Yeah, I'm talking about COVID. Yeah. I absolutely, because that's on everybody's mind. But I absolutely agree on measles. I mean, I came through the vaccination era. We all believe in it. Mm-hmm. And my sister, who has been fighting to keep fluoride in water and other things in Tennessee, can we compromise on 0.7? Can we do this? She's been at the legislature working on stuff for years, and I just, but it's. I think I don't know enough about it to debate one way or the other. I just try to help her where I can. But there are certain things that you may have credibility in arguing in certain circumstances it didn't work or it did work. But we deal with massive numbers. We deal with what works. And you take 1 million people and you see what works best, right? I mean, I don't know. I depend on people like you. So tell us what your typical day or week is.
Oh, gosh, I don't have a typical day. Sometimes I'm in school systems and doing hand washing with the kids, like I said before.
Yeah, tell me things you do redundantly over months or years. Things this will be part of my month, no matter what day it is. You're going to go to school.
Education. Yeah. So, doing education.
Do you do anything but education?
I do. I set up vaccine clinics for places that have people who are disabled and maybe can't travel, or some people who cannot read or write well, so helping those people that traditionally fall through the cracks. I do education to people who work in healthcare. So sometimes you'll know the person at the front desk, and because they're wearing scrubs, ask their opinion, but they don't have any education. Okay. And so we try to educate everyone that the patient comes in contact with. And sometimes it's, helping out, volunteering at different places, like some of these community partners that you're talking with. So sometimes I'll volunteer at Free Medical Clinic, volunteered with Habitat for Humanity, Second Harvest Food Bank. It's just wherever my community needs me in whatever capacity.
Do you have a staff at all?
No, it's me.
There's one person that helps you.
No, sometimes I have another navigator in the East region, but she takes care of totally different counties. If I can talk my teenager into helping me for some of these outdoor events, I do.
Good luck on that.
Yeah.
That's always tough. So that's good. So, and you're part of the University of Tennessee's program.
Correct.
You're part of the education region, and that's interesting. So let's talk about funding. I mean, you coming off a grant, what do you do after the grant goes away in the spring?
Well, I am getting my doctorate in psych mental health nursing, so I am going to really focus on this last year of clinical school. There are other nurses who are looking for roles. We're public health and community health nurses. Some of that funding has been cut. So it is, the nurses I work with are fantastic. So they're looking for jobs and we would love to continue this kind of education. I think it's so needed. But we've got so many skills, so many community partners we work with.
That can do stuff.
We're just trying to navigate a little uncertain time right now.
Yeah, and being in the political process, being a part of some of in relationships with Washington and stuff, my advice has been don't throw the baby out with the bathwater.
Right.
You got to find the problems and you got to fix it. And the problem, you get into something like USAID, international aid stuff, and then you find all of this graft in there. It was basically a conduit to get everything else they wanted done politically, and I got that. I understand. But basically that kills everything. Gone. Shut it down. Mm-hmm. So that's what we're going to see. I mean, CDBG grants going to be tough. I mean, I wrote grants for 10 years. I know about it, but it's going to be tough. How much grant money is available? You're going to have to depend more on private foundations and different issues. I don't know. It's early. It's early. I don't know. My world's the energy world, so it's a little bit different. But health you would think would be a priority for getting it fixed and getting the funding out there.
We don't want to get behind the ball on health. And so part of health is preventative health, and this is preventative health. And a lot of the things that are being cut are monitoring for disease outbreaks. If we can, get on it quick and get those people taken care of, then we don't have a disease outbreak that affects people's jobs, ability to send their kids to school. I worry about that.
I think the litmus test, and remember, I've got strong relationships with that side that's making those moves. I think the litmus test is simply a fact of, is it something that we really need to get done in a time frame and this and that? And can it be done by private, the old model, can it be done by private sources and stuff? And can the health people stay within the constraints of what they see as necessary? What you do, I think, falls within that. But when you're out there promoting stuff, not you, but other people out there promoting stuff beyond the fringes of what, like UT, I think is going to be fine. Vanderbilt's not going to be fine. They're going to come cut on Vandy because that's a research facility. It's got other stuff. This is my read on it. I mean, I don't know. You said you've seen health departments start to go. And
we've had, there's Knox County Health Department, and some of those nurses I worked with when I worked at the health department, great nurses, and they've been let go. A good friend of mine at Vandy, he's research.
You tell me, yeah.
A little bit about that. He does, looks at images of brains and all kinds of vascular systems, and
they got great people down there.
He is brilliant, and his lab is being shut down.
It's my wife, when she had the long-term COVID stuff started, she went to Vandy, and they were very professional, did a good job. But we ended up at the Cleveland Clinic because they just did stuff a little bit more, I don't know, not as much diagnostics and more let's treat this thing and get on with it, that kind of thing. So, and we got some great medicines out of it, which we ended up being common medicines combined. It was kind of interesting how they came about swelling in the head and stuff like that. So it was kind of interesting. So tell me what we need to do as a community. I mean, what do we need to do? Do we need to call Randy Boyd, a friend of mine, and say, you got to keep Denette on the streets, or do we need to get 1 million pamphlets out? What do we need to do? This is well done, by the way.
Thank you.
Did you do this?
We helped. We all helped together.
Okay. But
I would love to say that.
Being a political designer, you got to get it to them in a minute. I can look at this thing in a minute, and it tells me the basic information that I need. That's all. Nobody's going to care past that.
So we'll try to get those out. I think, it's talking to your doctor about immunizations, and then making sure that the person that you're getting health information from, what is their background? What is their education? Do they have a reason for trying to get you not to vaccinate your child? I know everybody just wants to protect their kids and do what's best. Our lawmakers, a couple years ago, we made it to where they could, you didn't have to talk to a healthcare professional if you wanted to go to school but not do any vaccines. You could just write it on a napkin and send it on. That shouldn't be. You should have to talk to someone in healthcare and just say, here's what you're risking. Here's what the risk of the vaccine is. And then make an educated decision. So I think
you wouldn't recognize Nashville these days. I mean, it's just completely different than it's been in the past. And I have to fess up, some of them are my clients, but it's very, very conservative and very, what's the word I'm looking for? Liberty driven. These people are, they're not big on government, and that's just part of it. And they want to run their own thing. Tell me real quick, 30 seconds. Tell me what a nurse navigator is.
So we are doing education, anything that we can help improve the health of our community, a lot of times navigating between different systems. So if we take someone's blood pressure, we see that they have high blood pressure, we're going to connect them with someone who can treat that. Medications.
Kate Hull, great.
Oh, I love free medical clinic.
Yeah, they're great.
They're great.
They did a great job. They took the money they had from the opioid and they gave them a large chunk of it.
Yeah.
Advocacy's great. But they're out on the ground treating people. That's right, and that's where you get.
And we
your
connect
results.
a lot lot of people to free medical
They
clinic.
mentioned very strongly to you. How much time, Chandler? 15 seconds. That's a lifetime, Chandler, underwater. So we're going to go. We're going to thank you again. We won't wait 2 years. Anything I can do for you, you let me know. I can give you my card and stuff. Just if we can raise some money or we need to do something, if you figure it out. Thank you, Randy Boyd, for funding this program at the University of Tennessee. I think it's a great program.
Yes.
Thank you, Randy Boyd, for funding this program at the University of Tennessee. I think it's a great program. Thank you, Randy Boyd, for funding this program at the University of Tennessee. I think it's a great program. Thank you, Randy Boyd, for funding this program at the University of Tennessee. I think it's a great program. Thank you, Randy Boyd, for funding this program at the University of Tennessee. I think it's a great program. Thank you, Randy Boyd, for funding this program at the University of Tennessee. I think it's a great program. Thank you, Randy Boyd, for funding this program at the University of Tennessee. I think it's a great program. Thank you, Randy Boyd, for funding this program at the University of Tennessee. I think it's a great program. Thank you, Randy Boyd, for funding this program at the University of Tennessee. I think it's a great program. Thank you, Randy Boyd, for funding this program at the University of T
From Oak Ridge, Tennessee, ID3 Global Solutions conducts operations around the world to enhance the U.S. national security posture and minimize radiological and nuclear threats. ID3 Global Solutions. Mission first.
Fan Gear Barn is Oak Ridge's source for new and vintage sports fan gear from around the world of sports. Find your favorite team gear at Fan Gear Barn, located at 977 Oak Ridge Turnpike, across from the hospital. Open 10 a.m. to 7 p.m., 6 days a week. Closed on Sundays.
Prescription drug misuse is a prevalent and potentially fatal problem. When people do not properly monitor, store, and dispose their medications, it can create an opportunity for misuse. Count it. Make it a goal to count your pills once every 2 weeks. Like it. Secure your medications at home. Drop it. Drop off unused or expired medications for proper disposal at any police department in Anderson County. For more info, visit asapofanderson.org. Brought to you by ASAP of Anderson. Prevention works.
Feeling overwhelmed with your business finances? At P&L Business Services, we handle all your bookkeeping, payroll, and tax needs. From federal tax returns to QuickBooks training, we've got you covered. With over 25 years of experience, we provide customized packages to fit your business. Focus on what you love most, building your business. Let us take care of the rest. Call 865-294-4792. P&L Business Services, empowering you to grow your business.
Over 14,000 neighbors live in fear of becoming sick or injured and having to make a choice between putting food on the table or seeking medical care. The free medical clinic tries to take that fear away.
Bringing the healthcare, primary care out to our rural communities, I've had patients tell me that if it wasn't for us, they wouldn't be able to have any kind of health care. So us being able to go into these areas and provide that on-site care to these patients that can also come back week to week if they need for follow-up primary care, it is life-changing. It means a world of difference between actually life and death for them.
Welcome back to the second part of our show. You know, we have a lot of, like the Nurse Navigator, like Denette and others, you have to explain stuff, and you have to understand what this nonprofit's doing, what that nonprofit's doing. But I think I was born into Habitat for Humanity. It seems like it's been around for 60 years. And pretty simple. We go out and build a house for you, for a family in need, and they get to take possession of the house. We'll talk about what that includes, but everybody needs a home. Mm-hmm. And it's good. I talked to the East Tennessee coordinator the other day. What do you represent in this situation? I mean, what you have 1 county, 2 counties, 8 counties?
2 counties. We have Anderson and Roane.
Tell me, Roane and Anderson's different, Charlotte. It's just kind of
very.
Yeah. It's a different world. Mm-hmm. It's an interesting world in the political world because they have a real high participation in everything in Roane. And that's because there's so many towns. Yeah. Like we have Oak Ridge and Clinton, right? I mean, there's some other fringes, but they have boom, boom, boom. They have like 5 different counties that have their own personality. So how's it going? You still building houses?
Yep. Got 2 going right now, and we're ready to dig for a 3rd one. We got 1 here in Oak Ridge on Waltham Place.
They need redevelopment up there. That's
yep.
Good.
And we've got another one going up on Clinch Street in Harriman. We're
I know that.
getting the survey and placing the house on the lot on Wainwright here in Oak Ridge.
That whole Highland View district needs overhaul. I mean,
and it needs overhaul by the nonprofits. Excuse me for saying that, but what contractors build is not affordable housing.
No, that's exactly right. That's exactly right. So your average house would have a value of $125,000, $100,000?
Oh no, not now. Now they're $275,000.
That's crazy.
That's what the appraisal value.
How many square feet?
1,200. 3 bedrooms, 2 baths. Oak Ridge. It doesn't matter who built it or where it sits.
That's crazy.
Yep.
That's crazy.
Yep.
I mean, I have a 2,500 square foot house I grew up in up on top of New York, and and it's gone from in 5 years. It's gone from 220 to 370 or something, something like that. But not 1,300 square feet. I got 26 or something. Yep. That seems like that should be under 200,000.
You would think.
So when I said 125, I was thinking about what
it cost us.
Yeah.
Our cost to build was $85,000 5 years ago, and now it's about $140.
And that's just because of the wood and everything. Yeah, because the labor's always been generated.
Well, we only have a certain amount that's volunteer labor. We can't have volunteers do trade work,
plumbing and stuff.
Plumbing, electricity, HVAC. Those have to be licensed. contractors.
Can a licensed contractor, he wouldn't be able to use this thing if he volunteered, I guess.
That's right. And we get deals sometimes, but they have to pay their labor. And you know what labor costs are now. Your average construction worker is $25, $30 an hour.
It's nuts. The whole thing's nuts.
It is.
I don't get it.
It is.
I don't get it. It's been that way for 3 or 4 years, and I can't figure it out.
It's not getting any better.
But you're right about the nonprofits or non-contractors building, because you don't have a motivation to cut corners or simplify stuff.
Well, we can't any more than anybody. We get the same, we have the same rules, the same code books, the same inspections. What makes ours affordable is we have access to different ways to set up loans for the houses. So a contractor just builds his house, he just has to sell it, and he doesn't really care how it's financed. Right. But we build ours, and then we use USDA financing, THDA financing. So sometimes somebody might have 4 different mortgages on one house, but they're set up back to back to back so that they can afford the mortgages, as opposed to paying $1,200 a month every month from the get-go. They can start out at maybe $800 a month.
And during my grant writing years 20 years ago, I'm very familiar with USDA. They helped us get water on Val Mountain. We got $1 million there in Nashville. Our good friend David Severs was the head of Tennessee at that point under President Clinton, and we got a lot done. Now, here's the central question. How's USDA's funding going to hold up?
Well, I have a meeting with them Monday in Cookeville, so we'll talk about that. But right now they're saying they have money. Will they have money in a year?
I think they'll have money through August 31st, yeah. The question is, will the new budget include them?
We'll see. Who knows?
And that's under the Agriculture Department.
Do what?
That'll be under Agriculture in the budget. USDA.
Yeah, right. Agriculture, yeah.
And they have a certain amount of money for that. So, yeah, it could be under TAC. It could be like, we're going to cut out the grants and that'll save us this much money. I could see that. So how much of the USDA money you get is, I know it's pertinent, I know it's important, but if you had no USDA money, would you build any houses?
Oh, yeah. We built, I haven't gotten any yet. I'm trying to get my first USDA rural development loan now.
I got you.
And I'll be honest, we didn't use any kind of government grants or funding until after the pandemic. And that is simply because the large organizations in the area, there's no incentive for them to give us large donations like there was.
Because?
Because they're paying such high taxes. What's their incentive? They don't get a good tax break anymore. So they've pretty much, where we used to be able to get.
You're talking about the corporations?
Yes, the big corporations, we used to be able to walk into the lab, Oak Ridge National Lab, $50,000, no problem. Now, get in line, fill out this application for $5,000. It's crazy. So
I'm trying to think in corporate law what the tax code has changed. I'm not sure how that works anymore, but.
And I don't know much about the tax code necessarily.
Well, that's what they're alleging. They can't save money anymore. So basically, I pay a certain corporate rate, which is slimmed down in 16, 17, that we pay less than we used to and different things. So they don't do the write-offs anymore, I guess, because they had a lower adjusted scale, maybe. That makes sense. I guess that's partly true. Okay, that's good. You know, you ever heard of Jenny Bowers? She played, I just thought, old people, I have to throw stuff up when I think about it. She used to play bridge with my mother. I was wondering if you, because you look a little bit alike, and of course that was a long time.
Bowers is a married name.
And I figured, but you might know.
And it's the name of an ex-husband.
I get
Nope, I don't remember Jenny and his family.
What was your maiden name?
Bush.
Charlotte Bush. Okay. What area of town did you grow up in?
West End.
Okay.
Still live in the same house my parents grew up in?
I do too. I bought it back. My mom sold it in 88, and I bought it back in 04. 16 years later, I came back from Pittsburgh and living up there in the east. And
right off Newport.
That's Roane County.
I know.
That's good. Okay, I got you.
That's why I'm a Roane County commissioner, because I live in Roane County.
You're a Roane County commissioner? You're on the county commission? I didn't know that.
My second term.
Wow. Good for you. I think I remember that. That's just like I said, I've got political lights in 17, 18 counties, but somehow I just don't get to roam very often. That's weird, isn't it? Yeah. Well, good for you, because the lady up at the top of Oklahoma used to be on there years ago, or a guy up there. I can't remember his name. Right at the top. Kelly.
There was a Miss Steve Kelly.
I can't remember.
He was passed 80. Away.
Yeah, he was older. Yeah.
And that's when I got into it.
He was. I can't remember much about him. Anyway, that's what. So, how many houses have you built in the last 10 years?
Last 10 years?
Yeah. Or something. Just a number relative.
Well, let's talk about what we're doing now, which is we're on point to build 5 in this calendar year.
Oh, that's excellent.
And that's good. And
That's
that's much
real
better
good.
than we've done in the past.
That's correct. That is better. Good for you. And your funding comes from volunteers mainly, but where does your financial support come from? And you said you haven't been using USDA. Have you been on other grants?
Mm-hmm.
Okay.
THDA is a big part of our funding. Tennessee Housing Development Accord.
Another federal pass-through?
Pass-through,
Yeah.
correct. But they do loans directly to our families, which helps us by we can get the money because up to...
That's right. That makes sense.
Yeah, to date, I have never used a loan. I have always financed the mortgage myself, which just means I get drops.
Meaning the
every month.
organization.
Yeah.
I didn't want to think your commission salary was big enough.
Oh, not commission.
No, I was joking.
Well, but-
That you personally said, I've always, and I thought,
Well, I'm in
making a
charge
joke.
of those.
No, I
So,
understand. I
yes.
understand. Do people, do you get, what is your individual donation total each year? How much money do you get from different people? I mean, communities?
You should have told me to bring a report.
No, I don't need all that. Just
That's hard to say. Lord, we usually get
tens of thousands?
Yes.
Okay.
Yes.
Ronan Anderson, anything you
Yes.
get?
Yes.
And that comes from individuals? and
Individuals.
Do you have a fundraiser
companies.
every year?
We played around with a few. I had a really good fundraiser in September. Do you know Gerald Boyd?
Very well. One of my favorite people in the energy
Mine
community.
too.
That
So
guy right there,
He's
I'll
been
tell you.
he's been on my board for years,
Yeah.
and so I
There
threw
aren't
a
many
fundraiser.
saints in the corporate world, but he's one of them.
Yeah, yeah, he's great. So I threw a party, if you will,
Sure.
in honor of Gerald Boyd, and people threw money at me for that.
Yeah.
And he didn't even want to do it. He said, "Oh, don't recognize me." I said, "No, you don't understand."
I understand that, too.
Oh yeah. Well, yeah, he's a very humble person,
That's
but
what all the saints say, right?
that's well, yeah. But what he does for Habitat and other nonprofits is very big, and he doesn't realize it. He can open a door
Yeah.
that I can only knock
Yeah.
on, and that's if they let me through the first door.
Yeah.
He
I started
can
a
get me in
music.
anywhere.
I started a music scholarship at Oak Ridge High School, named after my closest friend of 40 years, John Shuey, who died last year. And we've raised quite a bit of money. Chuck Weissman's coming in. We're going to do a fundraiser and do some other stuff. But yeah, you get the right names associated with stuff people want to. They don't want not to give Gerald the recognition,
That's
or
exactly
they don't want to give Chuck or whoever the recognition for whatever reason. Yeah, I'm a big fan of Gerald's. So, what is the budget? Don't have to have exact numbers.
Okay.
Sorry. What is it? What is the approximate budget of the Anderson Roan Habitat a year?
$1.5 million.
Okay, and that's house building materials, everything.
That's everything.
And 80 or 90% of that would be house construction related. I mean, you don't have any other expenses, substantial expenses like $200,000-300,000 in an annual
Well,
budget. Go ahead.
Okay. Yes, we have employees, so that takes expense.
How many?
16.
In
But-
Anderson Roan?
But we have 2 stores. We have one store
I
over
forgot
there.
about
We
the
have one store out
stores.
there.
Tell me
and
what
then
the
we have
stores
office.
do.
The stores brought in about 300,000 last year,
Okay.
so they do a great job for us.
I saw the pictures when I was researching on the internet. Just right
beautiful.
down here. And basically, it's like a Carm type facility. People come in. Wow.
Yeah.
So when people say to me, I'm going to go down and donate it to Carm, everybody knows what that means. It's a brand. When they say, I'm going to give it to Habitat for Humanity, if you're not involved, you really don't know that they have stores and do things. I didn't even know you had a store. I knew
Right there.
I knew it 20 years ago. I knew it 20 years ago because we used to take stuff there. But
Yeah.
in the last few years, that's really great.
Yeah.
And so what's your conditions on donations?
Well, we pretty
table
much will
needs
take
4 legs,
anything.
right?
Yeah,
Table needs 4
pretty
legs.
much anything. I mean, we prefer it if you don't bring us the couch that is the cat's peed on, but sometimes you might, and sometimes we can clean it up. We will attempt to clean it up, but
Sure.
the biggest thing that helps people is that we will come and pick it up from your house. You don't have to bring it to us. Just call us. We'll set a date. We'll come pick it up. Furniture and appliances are obviously the best sellers, and we get the most money out of. And what some people don't understand is if we get what looks like a brand new leather couch, we're not going to sell it for $200. If it was on the market brand new for $2,500, we'll sell it for $1,000.
Right.
We're not there to bargain. That's not what we're doing. That's an ongoing fundraiser. That's what that is. And so if you were to give that to me, would you want me to sell it for $200? No. You expect me to get the money out of it that will help fund my mission.
Now, I guarantee you, if they itemized their taxes, they didn't write 200 off, they wrote 1,000 off. You're right.
Absolutely. Because they fill in their own numbers.
So you provide in these stores that people donate, you raise $300,000 a year for your budget. but you provide. And I looked at it, looked like furniture and things of that nature.
We got just about everything, and that's just it.
Not clothing.
A little bit. We don't do a whole lot in it. We used to, but clothing is very labor intensive.
Yes, it is.
So we have
just like a yard sale.
Exactly. It's just a little bit of clothing, but keep in mind that we'll have a couch for $100, a couch that's a little nicer for $200, one that's a little nicer for $500, one that's really nice for $1,000, and then tomorrow when you come in, there'll be one for $200, one for $150, one for $800. Then the next day, because they sell daily, the turnover is constant.
That's good. Yeah, you have to be. You're generating $1,000 a day or more.
Oh, $1,500 a day.
Yeah.
Out of that store, and $500 a day in Kingston.
Wow.
That's their goals, and they've been meeting them.
That's good. How many employees run the stores?
The stores, there's just 3 in Kingston. 8.
Still, when you consider the hours and the manpower. Some
And
of those are basic wage people that are loading them and unloading them.
Well, that's just it. There's 3 different guys that work together and rotate on the truck because we go and pick up. We'll also deliver. If you buy something and you can't get it home, we'll deliver it for a fee, just like anybody. But we do pick up and delivers, so we have those trucks running constantly.
Right. That's interesting. Let's take a break and we'll go back to our last 15 minutes. Very interesting.
From Oak Ridge, Tennessee, IB3 Global Solutions conducts operations around the world to enhance the U.S. national security posture and minimize radiological and nuclear threats. IB3 Global Solutions. Mission first.
Feeling overwhelmed with your business finances? At P&L Business Services, we handle all your bookkeeping, payroll, and tax needs. From federal tax returns to QuickBooks training, we've got you covered. With over 25 years of experience, we provide customized packages to fit your business. Focus on what you love most, building your business. Let us take care of the rest. Call 865-294-4792. P&L Business Services, empowering you to grow your business.
Prescription drug misuse is a prevalent and potentially fatal problem. When people do not properly monitor, store, and dispose their medications, it can create an opportunity for misuse. Count it. Make it a goal to count your pills once every 2 weeks. Lock it. Secure your medications at home. Drop it. Drop off unused or expired medications for proper disposal at any police department in Anderson County. For more info, visit asapofanderson.org. Brought to you by ASAP of Anderson. Prevention works.
Over 14,000 neighbors live in fear of becoming sick or injured and having to make a choice between putting food on the table or seeking medical care. The free medical clinic tries to take that fear away.
What do we help them with? We help them with diabetes, hypertension, any kind of medical need that they need that's necessary. And being in a community with the African American community lets them know that we're here.
Fan Gear Barn is Oak Ridge's source for new and vintage sports fan gear from around the world of sports. Find your favorite team gear at Fan Gear Barn, located at 977 Oak Ridge Turnpike, across from the hospital. Open 10 a.m. to 7 p.m., 6 days a week. Closed on Sundays.
Welcome back. Once again, happy Easter. We're on the Thursday before Good Friday, so we hope that your family will celebrate, focus on what's important. You can't build a house without land, and everybody is landlocked for reasonable places from definitely Illinois this way. So the question comes down to, in Roane County, probably a different kind of issue, but they need land. Habitat needs land, and I'm pretty sure they're not going to ask you to donate it outright. They'd love that, but you're willing to purchase some land at the right price.
Absolutely.
The land bank has been helpful, but not as much. So if you have a home or you have a piece of property that you can't sell, you need to consider talking to Habitat Humanity about it. So let's say you have a lot that's worth 40 or 50. Remember, your lot's worth more now than it was, 40 or 50,000 on the books, and you get an offer of 20,000 on that lot. You can still write the other 30,000 off. There's things you can do to make it work, but you need to talk to Habitat for Humanity. Talk to Charlotte about possibly selling your lot or land that you have and getting it done. That would help the community very much.
Absolutely.
How many Habitat built homes are there in Anderson County since the inception of the program?
How many houses have we built? Well, we add the Anderson and Roan together, and
Okay.
so I think we're up to 110.
So what year did it start?
1992.
I remember Jim Hackworth was involved, and some other guys I know built. A lot of public officials were involved. I don't remember everybody, but I mean that there was or even a lot of names, but it was good.
And of course, there's Jimmy Carter.
Jimmy Carter, isn't that a great visual for you? What a great guy. He's like, there's another Gerald Boyd. I mean,
Yeah.
whether you agree with the politics or not, Jimmy, I can remember.
I'm not talking about his
Right.
presidency.
I remember when he ran for president. I was 21 years old, and he came to the old Holiday Inn down there. And he was just coming through in between Georgia governor and trying to get on the presidential ballot. And he came down to I think there was 5 of us maybe that had lunch with him or something. I was 21 years old. Let's see. No, I was 19 or 20, but it's kind of fun. It's kind of funny that everything started at that old Holiday Inn. People come through there. You know what I'm talking about. Right there where the Skyway was and everything. So, yeah, and Jimmy was always this very soft-spoken, nice guy. Nuclear guy, too. Yeah, he worked with Rick over in the Navy, got a nuclear engineering degree. He reminds me a lot of the politicians of today in the sense that rural, simple presentation is getting stronger all the time. Nothing simple about the campaign.
Right.
But anyway, it's a tough world. But anyway.
Well, let me say this. Now that President Carter and his wife have passed away,
yes,
the people who've stepped up to be our voice, to represent us, to bring us out to everybody is Garth Brooks and Tricia Yearwood.
Oh, isn't that great?
They are wonderful.
Yeah,
Yes, they still do what are the Carter Work Projects every year.
Man, Garth's a good guy. I've met him a couple of times. He's really good at Grand Ole Opry.
Yes, he really is.
And just a simple guy. Worked in a bookstore originally in Madison. He's just a great guy in Nashville. And his time's come and gone. I mean, in the 90s, I listened to his records all the time, and now you don't hear as much of those young superstars and everything else. And some of them are really talented. But Habitat for Humanity has just been a like you said, 35 years or 33 years of Games Day. When did it start overall? I mean, it started here in '92. Was it other places before that?
Yeah, in the early 70s.
Early, I thought so. When I was.
And it wasn't started by Carter. It was started by a friend of his,
of course.
Millard Fuller,
Yeah.
and he became the face. That's basically what Jimmy Carter did. He became the face of Habitat, and you need something like that.
Yeah.
It puts you out there, and people
Just
know
like
you are.
Gerald here locally, right?
That's exactly right.
That's exactly right. Yeah.
That's a good one. I'll tell him you
Gerald.
compared him.
You tell him. He's
I will.
great. He is super. I mean, it's not really the political person or the individual. It's just the level of compassion that both of them have, and everybody has for their communities and and the different things that they do. So, what's the hardest part of it? You want to do something today. You want to move a family in. How do you select your families?
Well, that's a process and a half.
I know, but
we have an application period, 1 month, sometimes 2 months a year.
Okay.
And that's simply because we have to be certified mortgage loan originators. We're not just winging it. We have to take all the classes, pass all the tests.
Sure.
So that means that we have to follow all of the deadlines. So we have to answer your application in a certain period of time. We have to have our responses all lined up. So that's why we only open it up a couple times a year.
Sure.
So we're not spending all our time all year answering.
Sure.
That's right. So you apply, and we look at, of course, your finances. And the biggest thing we're looking for is, do you pay your bills? Do you attempt to pay your bills? There's a lot of people who think, oh, well, they're just giving it to people who are poor. No. You have to have a decent credit score. And you would be surprised at the number of people, single parents, that come in with 800 credit scores that aren't making crap for a living.
I'd be surprised.
You would.
I mean,
Not
because they're not responsible, but it's kind of tough to get. You got to know the tricks to get up in the 7s and 8s now.
They live within their means. And that's really
never late. Yeah.
Never late. And I have talked to so many people. For example, a man came to do some plumbing work on our house in Murfreesboro not too long ago. And his wife, my husband was telling his wife that I was with Habitat. So she was real interested. So when he was finished, she said, tell him about how Habitat works. And I started telling him, and he said, well, I just got a new truck, so I'm going to bankrupt next year so that I can keep the truck. And I'm like, I can't help you. If you're playing the system, I can't help you. You have to be steady. You have to know what's important. You have to support your family the right way, not throwing money into the air. And credit is, you can have good credit without having a whole lot of money.
That's right.
promise you.
That's right. You may not get a loan because you don't have a job, but you can have good credit even with a minimum wage job.
That's exactly right.
It doesn't make you loan worthy, but it gets you past the first step.
Right. That's right. Well, and we will give loans to people with lower incomes than a bank would.
Right.
Because we're going to change. We don't.
The ratios are there.
And we don't do the mortgages the way a bank does.
Right, because you want to look at ratios and all that.
That's exactly.
So we don't worry about that.
We look at the ratios.
But you're looking for somebody to be responsible.
That's exactly right.
And you want to get through there and get responsible. That makes a lot of sense.
And so the people who are most responsible are the ones who are living in a place that just isn't as nice as you would like. It's got mold. It's got something falling apart. There's electric wires. There's all kinds of bad things about where they're living. And the reason it's like that is because they're paying their bills, not sinking their money into something they can't afford. Those are the people that we help. You know where to spend your money. So we're going to take you out of that situation. And for the same amount of money that you're paying for that crappy situation, now it's going to pay for.
Are there always kids involved in the houses you build?
Not always.
Okay.
Sometimes there's disabled.
Okay.
We built a house for a blind man in Harriman a couple of years ago.
What are the criteria for the loans? What makes a person more likely to qualify than somebody else?
The biggest things are willingness to cooperate. Okay. And believe me, that's a big one.
I got you.
Yeah. Also, your living situation. If and it may sound bad to you. Some people don't like this, but if we go to visit you and you live in this pristine house and everything's working perfectly, to us, that's not a need. Do you follow me?
I got you. I'm thinking about what you're saying.
Right. And so that's where we're looking for people who are living within their means, and that's the best they can do right now. And the best they can do is they're keeping it clean, but they can't control the mold on that ceiling. Right. They can't control the fact that their landlord won't come fix their toilet and sink and the floor's about to fall through.
So you have to be in a rental situation.
No. You can't own a home.
That's what I meant.
Yeah. But you could be, there are people that live with other people.
Right, because they have to.
Right.
That's our side. Senior citizens?
Oh, yeah.
You built houses for senior citizens? Mm-hmm. Yeah,
we cannot discriminate. We have to follow all the rules.
How many houses you built for senior citizens? A few?
A few.
Okay. I mean, the ability to pay the mortgage over a long term is not as relevant as...
No, and that's just it. You can't not give somebody a loan because of their age. That is not unless they're under 18.
Oh, yeah.
That's the only age barrier you can use.
But I mean, the client, the single mother comes in with 3 kids and she's been working at the gas company or somewhere, the electric company for 7 years. She makes her $19 an hour and she's got a lot of bills. That's your premier customer, don't you think?
Yeah, I would say that. Yeah, a single mother with children, but we've had couples that even together. They just don't have
all
the
the
greatest
ads
jobs
I've
in the
ever
world.
seen on Habitat, always a couple of things. I think I see couples a lot on Habitat.
You do.
I mean,
because, if one of them's working at the gas station and the other one's working at McDonald's, they're going to qualify.
Yeah. And I tend to get to know people in the grocery store and in the restaurants, and I like to go to the same people every time, so I get, I'm getting build that kind of thing. So I think it's interesting. And those kind of struggles exist. My husband's down there at this. I'm going to try to get some extra work with him. And it's so expensive right now.
It is.
It's crazy. I donate but I donate food considerable every week to the pantry at St. Mary's, because that's the only one in Oak Ridge of any size. And it's amazing. The lines are so long.
I've always said that if I ever leave Habitat, I would want to work for Second Harvest.
Yeah. They're big. They really do a lot of work. They help these smaller churches get the food and get it out and do stuff. And, you're right. You got to eat first before you buy.
That's right. You got to do absolutely.
That's exactly.
And really, we're more your end of the line. We're not the ones that are out helping necessarily homeless people. We're not passing out food.
Right.
We're not passing out clothing. That's not where we are.
No.
We're more of, you're trying really hard. We are going to help you change your life.
I think that owning a home is a quality of life
Absolutely.
experience. I really
Absolutely.
do. Well, I appreciate you coming on today.
Sure.
I think people need to, how do they make a donation to Habitat for Humanity?
You can go on our website, which is Clinch River HFH, standing for Habitat for Humanity.org. Click on the Donate Now button. You can do it online. You can always mail a check to 111 Randolph Road. We would love to have you give us $25 a month, and you can set that up on our website as well, because monthly donors.
We got to go, folks. Thank you for watching. really great organizations. Please try to support everybody.